this session, we are going to discuss the very important topic of pharmacology, that is a small molecule inhibitors. Okay, so the topic for discussion today is small molecule inhibitors. In small molecule inhibitors, please understand first very important thing जो कि पूछते हैं BRAF V600E inhibitor और generally they can ask you BRAF inhibitor के नाम बताइए. So in BRAF, please understand there are three words which are very important, and this is R, A and F. And this R, A and F is going to help you to remember RAF, Refenib. Okay, except, I'm putting it here, please understand, except sorafenib. Sorafenib has RAF, but it is not a BRAF inhibitor. Okay, next is MEK inhibitors. Next is MEK inhibitors. In this MEK, M and E are very important, and this M and E gives you metinib. Next is proteasome inhibitor. So let us write proteasome inhibitor. So zome you can remember zombie. So zomib, anywhere you see zomib, it is proteasome inhibitor. Okay, like for example, one more thing which you give as a proteasome inhibitor in the case of multiple myeloma is going to be carfilzomib. Okay, that's called as carfilzomib. कार में भर के zombie वापस नहीं आते, that means it is irreversible inhibitor of proteasome. Okay, next is, okay, you got it, कार में fill, कार में भर के वापस नहीं आएंगे, that means it is irreversible. Next important is hedgehog signaling pathway. Hedgehog signaling pathway. So I'll write it here, hedgehog. Okay, you got it, very good. Now hedgehog का क्या function है, क्या काम करता है वो, it digs the pit. ठीक है, वो गड्ढा खोदता है. Okay, so digib. ठीक है, so wherever you see digib, that is hedgehog signaling pathway inhibitor. Next is JK, that is JAK inhibitor. How I remember, J and K for Jammu and Kashmir. Jammu and Kashmir is a city, so we can remember Citinib. Okay, Citinib. Okay, sometimes you can always see Litinib. So Jammu Kashmir is no less than a lit city, although it is a state with due respect, but then we can remember like that. Okay, lit and then sit. After that, next is histone deacetylase inhibitor. Okay, so I'm writing histone deacetylase inhibitor. Remember this ON in the histone, if you reverse it, it becomes no. So one is no stat. And next is romidepsin. One more is romidepsin. And one more is, for example, panabinostat, that is approved for multiple myeloma. Okay, multiple myeloma की गाड़ी रुकती ही नहीं है, there is no stat. ठीक है, रुकती ही नहीं. Now how will you remember romidepsin? ठीक है, so how will you remember romidepsin? Please remember that romi and multiple myeloma दोनों की गाड़ी नो स्टार्ट. ठीक है, यू कैन रिमेंबर लाइक दिस, रोमी और मल्टीपल माइलोमा दोनों की गाड़ी नो स्टार्ट, एंड मल्टीपल माइलोमा हैज गॉट पेनाबिनोस्टैट. ओके, बट रोमी की गाड़ी, दैट मीन्स रोमिडेप्सिन इज ऑल्सो, गाड़ी नहीं रुकती है, मीन्स नो स्टार्ट मीन्स histone deacetylase inhibitor. Next is PARP. PARP inhibitor. Now remember PAR. Please remember this PAR. So this is going to be parib. This is going to be parib. Okay. Please remember this is something which you give in ovarian and breast cancer. Ovarian cancer and breast cancer. And breast cancer भी कौन सा, which is HER2 new negative but BRCA positive. How to remember? Parib, very similar to as pretty. And who can be pretty? Obviously females. So it is a ovary and breast. Okay, you got it? Okay. But remember, very important thing, that parib is given in the breast cancer, which is HER2 new negative and BRCA positive. Now she's a pretty female, and you know that one pretty female can never digest that other female. I think it's sufficient. One pretty female can never digest the other female. That means two, second female, her, no, she should not be there. That's HER2 new negative, but BRCA positive. Next is going to be CDK. CDK 4 and 6 inhibitors. CDK 4 and 6 inhibitors means there is, please understand, there is a cycle. Okay, there is a cycle CDK 4 and 6. Now how to remember? If you remember, we used to have CDs, right? You remember there was a compact disc CD. So CD, if you one CD, second CD, if you join, and my handwriting is not so good, but if you join, it can remind you of a cycle. Okay, and this cycle, that cycle, and ये साइकिल कब चलती है? क्रिकेट के ग्राउंड में. क्रिकेट के ग्राउंड में चौका और 4 and 6s. Okay, समझ गए? So CDK 4 6, that is cyclib. Okay, next is going to be BCL2. Next is going to be BCL2 protein inhibitor. BCL2 protein inhibitor is, remember this, CL. Okay, so this CL for clax. For clax. Okay, so this was about the small molecule inhibitor. Okay, let me just quickly revise it for you. So sorry. Yeah. So first of all, BRAF, remember this RAF is going to be rafinib. Next, except the sorafenib. Please remember sorafenib is not. If anybody from you is from Punjab, you know what is sora. Okay, that's the father-in-law. Father-in-law is never a cool guy, is never a BRAF. Okay, next is going to be MEK. Okay, so MEK, ME word is going to be there. Next is going to be, okay, can you see we have cut B in RAF, and here also in the last BCL2 B we have cut because clax is there and rafinib is there. Okay, you got it, very good. Next is going to be proteasome inhibitor. Now proteasome, zombie, but remember multiple myeloma has carfil zombie. Okay, next is going to be hedgehog. So hedgehog ka function, digabe. Jammu and Kashmir is a lit city, city name, litty name. After that we have got histone, so no stat. Remember Romi, as well as one more, that is no stat, is the multiple myeloma, and that is panabinostat. After that we have got PARP, so please remember parib. Okay, but parib is pretty, so pretty is a girl, ovary, breast, and does not like the another girl. Second girl does not like, HER2 new negative, BRCA positive. CDK 4 and 6 negative, cyclib. I have multiple times told you that if you I have multiple times informed that if you combine two series, this leads to the formation of a cycle, so cyclib. And yeah, this is BCL2 protein inhibitor. Please remember CL, that is clax. Okay, so thank you so much for joining, and this whole notes PDF I'll share on the Telegram channel. The link is in the bio of the page. You can join our Telegram channel from there. Thank you so much, and please tell us what all topics do you want us to discuss in the comment section, so that we can discuss it. I know that pharmacology is a little bit ulti seedhi, so definitely that's a difficult topic. That's why I've started with it, and yeah, I'll be taking your advices, and then we'll be putting more videos. Thank you so much once again. Thank you.